Well, let's go to a big case that we have acquired a lot of information about, and a big subject as well, which is chronic Lyme disease. You've had extraordinary success using B.A.H with Lyme disease patients, and we recently have a case review where we show a 95.6% success rate in 199 chronic Lyme cases that were treated successfully. Why do you think it is that other methods can't seem to get that same success, and how did B.A.H allow you to achieve those types of results?
Well, in most of the other methods, whether it's conventional or not conventional, trying to treat the diagnosis of the patient, not the patient itself. So this method is looking for something else. This method is looking how to restore the health, not only killing the microorganisms, but restore the proper health of the patient. So using B.A.H, we follow what individual case will require. In most of the cases, of course, will be determined that these patients will require detoxification, restoring of the proper environment, milieu of the patients, but also restore the proper information, which is done by balancing of the energy of the patients. And after this, we select the proper treatment for elimination of the infections. And the proper treatment is different for each patient, depending what they will require and what is most compatible in their cases. So it's extremely individual, personalized program of the treatment. And when we follow the intelligence information from the patient, the success rate is extremely high in any conditions, but in Lyme conditions especially, because this condition is following some very biological laws, which is easy to determine in very quick way using B.A.H and eliminate any causes which interfere with healing of the ability of the body.
Right. I remember that in San Diego when you spoke at ACAM, you said that Lyme disease has it all, meaning that it has toxicity, it has environmental problems with the internal milieu, it has multiple infections, oftentimes viral infections as well as bacterial. So there's a lot of different organic problems going on.
Absolutely. The Lyme disease is a representation of the typical 21st century patient with all different dysfunctions. All of these 21st century patients are very toxic. They have a lot of emotional issue. There is the difference because of the toxicity. This is the different milieu, which is a pathological milieu. These patients have many nutritional problems. These patients also have, of course, infections.
Right.
So, and energy, poor transmission of the information in the body. So this is the excellent presentation how the biological medicine, including also energy medicine, is successful in these cases and is successful in the other chronic conditions.
And as you mentioned before, it's really the specificity afforded by this method. Like you said, no two protocols are alike, just like no two people are alike. But if anyone has more questions, they're always welcome to email them to drtom@innovativemedicine.com, and we'll do our best to get back to everyone in a timely fashion. So Dr. Szulc, thank you so much, and appreciate having you tonight.
Okay, thanks a lot.
Thanks a lot.